What causes cancer? Cancer is a disease caused by uncontrolled proliferation of abnormal cells in any part of the body. Any part of the body, right from the mouth to the entire intestinal tract, all your internal organs like the lungs, the liver, the kidneys, the breast glands, the female reproductive system, that is the ovaries and the uterus and the cervix, can be affected. Cancer can also involve your bones or your muscles as well. What causes it? Cancer is a very complicated and a multifactorial disease in which the cause for the cancer can either be because of either genetic factors or environmental factors, both which ultimately damage the DNA of the cells in our body. This damage to the DNA of the cells triggers an uncontrolled growth of cells which cannot be kept in check by our body's normal metabolic pathways and the immune system, thus resulting in an uncontrolled growth of cells which produces a lump or a tumor. Why are there several deaths because of cancer? Even today, modern medicine has yet to find the cure for most advanced cancers. There are very few advanced cancers which can be completely cured by modern medicine. The majority of the cancers today, if they have spread to the advanced stages, that is the third and the fourth stage, they can only be palliated and a person's lifespan can be prolonged and their risk of death can be reduced as opposed to not giving them any treatment at all. Hence, for advanced cancers of the lung, of the gastrointestinal tract, advanced sarcomas, the prognosis still remains poor as the majority of patients do not survive very long after their diagnosis. Hence, early diagnosis and treatment is the key for cure. How does cancer spread through the body? Cancer cells can spread through the body through a variety of ways and pathways. It can spread through direct infiltration and direct spread of tumor cells from one organ to an adjacent organ, like a cancer of the lip or the tongue can spread further down deeper into the posterior half of your tongue or the cheek or the bones in your face. Or cancers can get access to your blood supply system, and these cancer cells, they get dislodged from the main tumor bulk, they enter the blood supply and they go by, and then they travel to the distant organs like the lungs or the liver or the bones or sometimes even the brain, and this is known as hematogenous metastasis. Cancers can also sometimes gain access to the lymphatic system and produce lymph node metastasis in either nearby places or even in distant places. Do all cancer types show symptoms? The answer is no. There are quite a few cancers in the human body which do not show any symptoms in the early stages of the disease, and that is why patients are usually diagnosed with these cancers at advanced stages. Several examples come to mind. For example, let's take lung cancer, which is now the leading cause of cancer-related death in our country. Lung cancers, when they are in the first and second stages, many patients, they don't develop any symptoms and the cancer keeps growing and spreading inside the body, and it is only when it has spread to the third stage that some patients start getting symptoms like persistent cough, or they might develop a pneumonia, or they might develop fluid buildup in their lungs. and by this time the cancer has usually advanced to a third or the fourth stage, and the majority of patients are thus diagnosed in these stages only. How can one prevent cancer? Depending on the type of cancer that we are discussing, there are a whole list of preventive strategies that can be followed. Let's take lung cancer again for example. We all know that cigarette smoke is the biggest carcinogen that we have out there in modern society, but still people continue to smoke cigarettes and use various forms of tobacco and tobacco related products. This one carcinogen contains more than 70 to 75 different types of confirmed cancer causing chemicals in it, and is single-handedly responsible for the majority of lung cancers that we see every day. So one should avoid cigarette smoking and avoid tobacco in all its forms, and one should also avoid intake of alcohol as well. Apart from lung cancer, if you look at some other preventive strategies, let's take breast cancer, which is now the most common cancer in Indian women. It is estimated that 1 in 20 urban Indian women will develop breast cancer in her lifetime. Again, cigarette smoking and alcohol also increase the risk of developing breast cancer, so it is best avoided. Also, women should try to have their first child before the age of 30 years, breastfeed their child for the recommended duration of time, and avoid cigarette smoking and alcohol, like I have just said. Maintain their body weight in the healthy range, engage in a good amount of moderate aerobic activity, and consume good quantities of fresh fruits and vegetables in their diet. How can cancer be detected early? Again, it depends on the type of cancer that we are discussing. If you take breast cancer for example, now we have a standard screening protocol for diagnosing breast cancers at an early stage. I'm sure all of you have heard about mammograms, but you should know when to do a mammogram and when not to do a mammogram. Mammogram is not recommended in younger women less than 40 years of age because their breasts are dense, and the likelihood of a mammogram picking up a breast cancer is very low in this age. So it will result in unnecessary stress and unnecessary invasive biopsies if something suspicious comes up on the mammogram. However, women, once they cross the age of 45 years, are recommended to undergo a mammogram of their breasts annually till the age of 54, and if all their previous mammograms have been normal until then they are advised to undergo a mammogram once in every 2 years thereafter. If you take cervical cancer as an example, pap smears are recommended to pick up cervical cancers in the very early stages, and all women, despite in spite of receiving the cervical cancer vaccine or not, or whether or not they have undergone a uterus removal or a hysterectomy, are recommended to start screening pap smears after the age of 30 years and continue this once in every 3 years in conjunction with a human papilloma virus DNA test once in every 5 years till the age of 60 to 65. If you take prostate cancer as an example for men, once men cross the age of 55 to 60 years, they should discuss the pros and cons of prostate cancer screening with a simple PSA blood test with their oncologist. What can you do if you are detected for cancer? The most important thing is that you should never panic. Consult an oncologist with all your reports as early as possible. Do not delay and waste crucial time in seeking alternative forms of therapy which are of unproven benefit. Always get a second opinion regarding your treatment before starting your cancer treatment journey, and use the excellent online portal of onco.com and get access to a virtual tumor board which will help to guide you and give you the best possible treatment option for your cancer.